My proposal, robotics and nursing. A robot costs almost as much as a year's pay for a nurse. I would like to get 2 high-quality robots for Wexford General Hospital. There will be a 3-week trial. 1 week, the programmer will be there with the nurses. The next 2 weeks, the nurses will operate the robots by themselves. Over a nurse's career, he or she has an 83% surety of back pain. That's a high number. And the labor shortage, extra shifts, the psychological stress that nurses are under, a robot could maybe help with that, take some of their work away. They can do meals, laundry, vitals. Just taking that off a nurse's plate would be a great source of help. Robots can work 22 hours a day on a 2-hour charge. I project there would be fewer days of work missed due to back pain or burnout. Because the robots can flip patients for nurses, that's often the thing that's the heaviest for them, is flipping patients. Robots can do that very gently. They can take patients to shower. And overall, there will be better patient service at the hospital due to nurses not having their time consumed with mundane tasks that the robot could take over. Nurses surprisingly have a positive view about the attitude of nurses surprisingly have a positive attitude about the robots they work with. They really like them, but distrust of robots does need to be addressed. Robots can even help patients with loneliness. They can connect the patient to social media and their family. They can play cards with a patient, and they can even take a patient out for a walk. And after the robot is paid for, after a year's pay for a nurse, the robot's paid for, and you get an average of 20 more years of labor out of that paid-for robot. So that's like free labor, and it will really help the nurses, and they need some relief. So give my proposal a try, and just go through the trial and see if they like the robots, if there's a use for the robots and a place for them. And I think you'll be surprisingly surprised.